All right, hello, and welcome to this edition of Your Health, Your Wealth. I'm your host, Dr. Eddie Patton, and I want to talk today about some of the interesting diseases or conditions that I treat. Today, we're going to be talking about Myasthenia Gravis, and I know that doesn't roll off the tongue well, but Myasthenia Gravis is an autoimmune neuromuscular condition. And I love talking about myasthenia because over the years, we've had such an evolution in the treatment for this disease that it's a really interesting topic and something for you to know about and know some of the symptoms so you can recognize it, maybe not just maybe yourself or someone else. And it gives us some insight into what's going on with treatment in neurological conditions and this explosion of new innovative treatment that has allowed me to treat myasthenic patients better and get them to the point where they're doing well without some of the side effects of treatment. So we'll dive into the disease and we'll learn more about what causes myasthenia gravis and talk a little bit about some of the treatment as well. I mentioned earlier, myasthenia gravis is what's called an autoimmune disease. That means that your body builds up antibodies to attack itself. Your normal immune system, if you have a bug or a bacteria from the outside that comes in, your immune system creates these antibodies that float around in the blood. They attach to this bug that's inside your body, and they call in all of their buddies to come in and seek and destroy. The problem is when you have an autoimmune condition, your body will build up or start this immune attack on itself, and it can attack different parts of the body. But in myasthenia gravis, it attacks the junction between the muscle and the nerve. So that is why it is an auto, meaning yourself, immune, meaning we're ramping up an immune response against ourselves, particularly at the junction between the muscle and the nerve. Now, because of this, and because it's affecting the junction between the nerve and the muscle, the most of the signs and symptoms of myasthenia gravis are muscle weakness, and particularly in muscles that work a lot. So usually one of the first signs and symptoms you see is with the eyelids and what's called ptosis, where you have drooping of the eyelids and weakness of the eye muscle. Throughout the day, we don't pay attention to how many times we blink or how our eyes are constantly moving around. Well, it takes a lot of work and a lot of acetylcholine at those neuromuscular junctions for that to work. So that's why one of the first signs of myasthenia gravis can be weakness of the eyelids and double vision because the eyes don't move enough. So we call that ocular myasthenia gravis. The other big thing about this disease clinically is this what's called fatiguable weakness, meaning that as the day goes on, the symptoms get worse or the weakness gets worse. One of the things we think about or listen for with myasthenia gravis is, fatiguable weakness. Do your symptoms get worse as the day goes on? In the United States, you have almost more than 80,000 people who have myasthenia gravis. So it's a large number of people. It tends to affect women in their 20s and 30s, and then they have a second peak in their 50s and 60s. And in men, the myasthenia gravis incidence tends to be a little bit later in their 60s and 70s. You'll see a peak. But you can have symptoms throughout your whole life is an important thing to understand. And knowing a little bit more about the disease and at least understanding what it is, I've had a lot of people who've been misdiagnosed, underdiagnosed, and undertreated because they didn't know enough about the condition. Now, it comes in two main forms. The first one is what's called ocular, and that is just when the muscles of the eyes are involved. Again, the drooping of the eyes and double vision. But then it can go on to do what's called generalization, where your whole body becomes involved. You get weakness of the arms and legs. You get difficulty breathing, difficulty swallowing. That is the generalized myasthenia gravis. And an important thing to understand is that a large percentage of patients who do develop ocular myasthenia gravis initially, which is the mildest form, they do go on to develop generalized within the first 2 years after that diagnosis of ocular myasthenia gravis. So if you do have ocular myasthenia gravis, you still need to talk with a specialist and understand the signs and symptoms of generalization, so you'll know how to prevent those things from happening. Now, in the generalized form, this disease is called myasthenia gravis for a reason. Gravis for grave, meaning that before steroids, before the 1960s, before the wide use of steroids, there was a high morbidity and mortality rate. More than 80-90% of patients did very badly from this disease and high rates of death. Because it affects the muscles and weakness and can affect the muscles that do a breathing, there are a lot of breathing issues, which led to a lot of morbidity, mortality. You lose your ability to swallow, and this can cause aspiration pneumonias. So you would see that a lot. So a lot of people ended up in the ICU. And even today, you can have what's called a myasthenic crisis, which can land you in the intensive care unit and having to be intubated and so forth. The good thing about that is, since the time that I've been practicing neuromuscular diseases, the number of patients that have actually gone into myasthenic crisis and ended up in the intensive care unit has drastically decreased, and that's a large part based on the new treatments that we have, and we're treating these patients a lot better. And so we're able to keep patients out of the hospital, keep patients from being ventilated by being more aggressive and using some of these new and innovative treatments, which work well without a lot of side effects. Now, within the classification of myasthenia gravis, it can be classified as either antibody positive or antibody negative myasthenia gravis. And what that means is that in some cases we can identify the actual autoantibody that we are creating against the neuromuscular junction. And 80% of the time, it is what's called the anti-acetylcholine receptor autoantibody that's causing the problem. But there are other antibodies. There's LARC4, there's MuSK antibody, MuSK. So there are other antibodies, and it's important to know your antibody status because there's certain treatments that we know that are either approved or we know that work better with certain autoantibodies than others. And there's some people who are what's called seronegative, which means they don't test positive for any of the antibodies. That doesn't mean that it's not myasthenia gravis. It just doesn't mean that you're able to detect those autoantibodies. You can still treat, and you should still treat, antibody negative myasthenia gravis, understanding that your treatment options may change or be more limited, and the response to treatment may change as well. But it's important to know your antibody status so you'll know which treatment may be right for you. So what happens, or what's the main driver for this disease that causes a problem? Well, when we think about the nerve and the muscle junction, your nerve doesn't just plug into your muscle like a light socket and tell it to go or work. There's actually a space between the end of the nerve and the neuromuscular junction. And the way that signal gets from the nerve to the muscle to tell it to work is with the use of these little particles called acetylcholine. So you have an acetylcholine receptor on the muscle membrane that receives the acetylcholine that comes out of the nerve. It links on there and it tells the muscle to go. So if there's a problem with the acetylcholine or a problem with the acetylcholine receptor on the muscle membrane, then this can cause weakness because your muscle is not going to get that signal and tell it to work. So it's a couple of ways in which antibody positive or myasthenia gravis we think causes a problem there. Number one, you can block the acetylcholine receptor. So these autoantibodies sit in the receptor, so the acetylcholine can't bind there. And if that happens, then the muscle doesn't get the signal to work. These autoantibodies can also bind up several of the acetylcholine receptors together. And when that happens, the body thinks that, hey, these things are broken. We need to get rid of them. It internalizes and breaks down the acetylcholine receptors. So now you have less of them. So now some of the receptors are being blocked, and now some of them are being broken down. So you become weaker and weaker. And another way is that these acetylcholine autoantibodies can call in another form of our immune system called a complement system. And the complement system is like your attack system. It's the one that goes in and gets all of these encapsulated bugs and different things, bad things floating around in your body and tells your immune system to destroy. So when you have the acetylcholine antibodies binding to the muscle membrane, it can call on the complement system and tell the complement system to, destroy, but that ends up messing up or destroying the muscle junction. And the reason I wanted to go through this in detail, because later on we talk about some of the treatments, you'll see how this all comes into place. The goal again of treatment is to try to increase a person's lifestyle to make sure that we reduce the weakness, but we have to take that into account also by minimizing the effect of the different treatments on the body. So for instance, when I was training, we really had minimal treatment. It was called acetylcholinesterase inhibitors, which are treatments that decrease the breakdown of the acetylcholine. So you have more of that in the junction. Hopefully that will help the muscle to go. And we still use this as like the mainstay of treatment. And by the way, always talk about your treatments with your doctor. This podcast is to give you information, but again, all this information should be verified and talk with your doctor or meet with a neuromuscular specialist. So the acetylcholinesterase inhibitors are kind of the baseline treatment. We start with that. Then we used to add on something like steroids or IVIG. These immunomodulating therapies became the mainstay of treatment, because if you can calm the immune system down and we're not ramping up all of these autoantibodies, then the myasthenia should get better. Another big thing, there were some studies that were done that found that there's a gland called your thymus gland. Now, your thymus gland is mostly active when in infancy and when you're a child to really help to develop your immune system. But later on in life, like in autoimmune diseases, it can become hyperactive, or you can have a thymoma or a thymic hyperplasia, where it's actually spitting out these autoantibodies. So by taking out the thymus, we found that helps as well reduce myasthenia and helps people to go into remission. So it's important first and foremost to identify patients early, because again, as this disease progresses, the symptoms can become very bad, and you can have things like shortness of breath, problem swallowing. These severe symptoms that can affect your life. And it can even be to the point where, like, I had one patient who her whole job was like telemarketing, and an issue came up at her job where I actually had to send a letter saying, hey, she has this condition because her myasthenia affected her voice. So as she continued to talk, her speech would become slurred, and you could hear it almost as though they thought she was doing drugs or drinking alcohol on the job, but it wasn't. It's just that she was having fatiguable weakness in her talking to the point where, again, people thought that she was actually doing drugs. So these symptoms can have a tremendous effect on your life, but we have ways to treat it and to make it better. A couple of other things before we get into some of the treatments is that there are certain things that make myasthenia worse. that if you have the diagnosis, it's important to get involved with like the MG Association of America, or, I have resources on my website as well, because things like certain medications, if your cardiologist or your family practitioner doesn't know you have myasthenia gravis, they may actually prescribe a medication that can make the myasthenia gravis worse. And there are a whole list of these medications that you can get from some of the resources I mentioned earlier that you should try to avoid if you do have myasthenia gravis. The other thing are things like heat or infections. Anything that stresses the body can make myasthenia gravis worse. So you want to be real careful about those things as well. So now let's talk about treatment. And again, I'm very excited about this because years ago, we didn't have a lot that we could do, and we were constantly battling the effects of the treatment on patients. No two people are treated the same. This condition is a very personalized condition, meaning that how your treatment regimen may be different from the next person with myasthenia gravis. It depends on how serious it is and so forth. But we usually start with the acetylcholinesterase inhibitors, and then we used to just layer on steroids. And these could be oral steroids or IV steroids. There are other immunotherapies such as nonsteroidal anti-inflammatories like azathioprine or mycophenolate that you can add on. But all of these things have side effects. So you're constantly battling the differences between the side effects of the medications and the actual treatment. But they do work. And especially we talk a lot about economics here, but steroids are cheap. And so if we need to go with a route to put for different reasons on a more inexpensive, steroids do work, but they do have side effects, and you have to balance that. We talked about thymectomies as a form of treatment as well, and there's been good research lately that really works. The immunomodulators like IVIG and plasma exchanges, what these tend to do is, like for instance with IVIG, you give extra IG immunoglobulin, so it blends in with the old with the bad immunoglobulin that's being created by the disease, so it's less of it to bind to those receptors. And with plasma exchange, you're actually filtering out some of those immunoglobulins. Now, a couple of years ago, we started to see a lot of research and new medications that have come out to help with myasthenia gravis. And what a lot of these medications have done is allowed us to now be able to treat myasthenia gravis. Patients are getting much better, and we're able to come off some of these other medications like steroids or different therapies that have a lot of side effects. So we're able to treat patients. They're getting better faster and without side effects. One big class is what's called the complement inhibitors. If you remember earlier in the podcast, I talked about how myasthenia works. And one of the problems is that it calls on this complement system, which is a part of your natural immune system. But if it's revved up against itself, it can cause bad things, particularly at the muscle membrane. So there's this new line of medications called the complement inhibitors that were created. And what these medications do is that they essentially block the last stage of this whole complement system. So you're still protected with most of the complement, which again is a natural part of your immune system that you need. But the end part that creates this membrane attack complex that goes in and actually attacks the membrane, they block that stage. So very effective at controlling this particular mechanism of how the myasthenia gravis affects the muscle membrane. One of the biggest potential side effects is that because this again is part of the mechanism that attacks certain different type of bacteria, it does increase risk of Neisseria meningitis. So you have to have what's called a meningococcal vaccination before you're started on these treatments. But there are different programs, different ways to get that, and that's just to reduce your risk of meningococcus infection with this treatment. It reduces it, doesn't eliminate it, but by having the vaccination and monitoring, this drastically reduces any potential problems with that. So this has become a very effective tool and very effective treatment in treating myasthenia gravis. The other class of therapy is what's called the FcRn inhibitors. And the best way to explain this is that your normal immune system, IG, immunoglobulin is good. And I'll just call it IG from now on. So you have IG floating around that fights bacteria and different things that are coming from the outside. But when your body is creating these for instance, anti-acetylcholine autoantibodies, it's considered bad IG because it's attacking itself. So what the FcRn inhibitors do is that they block this protective form to recycle the immunoglobulin. So you're actually able to destroy some good, but mostly, but also some of the bad immunoglobulin that's in the body. And this reduces your risk of those anti-acetylcholine antibodies floating around in the blood and decreases the disease burden. So consider these therapies as very targeted, very strategic therapies. So it really has helped over the years to reduce the need for this kind of generalized, think of like steroids and the larger immunomodulating therapies is kind of carpet bombing the whole system. But now with new therapies, and there are others that are coming around as well that you're going to hear over the next couple of years, different mechanisms of action and so forth. But we're now able to be a lot more strategic in how we're treating myasthenia gravis, and we're able to get people better and reduce potential side effects of the medication. So in general, it is an exciting time in myasthenia gravis because this disease used to have such a profound effect on people and such a high morbidity and mortality. But now through therapies like steroids in the past and immunomodulators, IVIG, plasma exchanges, we've been able to really treat people and help to increase their quality of life, reduce the side effects of therapy as well. And now more recently with the newer therapies, we can now treat patients more targeted or get them off of some of these other medications that could cause a lot more problems with the medication than the actual disease itself. It's important to understand the signs and symptoms of myasthenia gravis. Fatiguable weakness. In advanced disease, you can have shortness of breath or even problems with swallowing. And if you have those symptoms, go in and see a neurologist, see a neuromuscular specialist, so that doctor can get you on the best treatment for you to increase your quality of life and get you back to your normal activities. I hope you've enjoyed this edition of Your Health, Your Wealth. Please subscribe, download, share it with your friends and family, and tune in for future editions, and we'll talk to you soon.